keep it short and sweet. That's the objective. So very quickly, my name is Sumit, and I've spent a fair amount of time in hospitals and insurance companies across countries. We're now going to talk about smart hospitals, which is what the need of the hour is. So there are critical pressures facing healthcare, as we all know. Significant challenges. Of course, the customers definitely are wanting more to today's Gen Y, Gen Zs. And 75% of the problems we are facing, mortality, morbidity, are happening with the lifestyle. So that's a bigger challenge because hospitals need to kind of become more equipped to manage this better. So to me, that's what, we all know that our challenges confronting healthcare, and we know the number of doctors are not enough. The time we have is limited. So there has to be some role of technology to make this easier and better, for healthcare professionals. I'll talk about the various stages. We don't even need to get there, but there is a prevention aspect. There is basically a post-care aspect, and of course there is a whole piece between the walls of the hospital. But you do need continuity of care. That to me is most important to really enhance the actual experience of the customer. We know lengthy waiting periods. We know multiple tests that need to happen in terms of better diagnosis. We know challenges in terms of lack of remote support. You're on your own after you leave the hospital. And there are challenges also in terms of actually knowing where to go, because there is so many specialties that become very difficult, extremely difficult for a patient to navigate his way through the maze. And that's what we basically say, when we look at some of the earlier conversations we heard, a person who basically gets a bad experience, as per research reports, it says 81% time does not visit the hospital again. So one bad experience, you lose the customer for life, and maybe his whole family as well. So that's the challenge. And we know this is what today's consumers are demanding from healthcare. So I'll kind of talk about how we see the Amazons, the Swiggy, and the Ubers. They've spoiled consumers. They are now looking at much more convenient, much more effective and efficient ways of interactions. And that's where healthcare needs to evolve to. And that can only happen when you start looking at creating an ecosystem. An ecosystem which is, in some ways, enhanced by technology, enabled by technology. So if I look at aspects like integrated care, health boards, of course, full body screening that is now possible. You have a lot of subscriptions happening. You can have home sample collections, a whole bunch of things that can be done to enhance experience, which also can ensure much more personalized medication. Because one size does not fit all, unfortunately. Medicines today are actually able to serve the needs of most people, most of the time, but not if it was your mother, not if it was somebody loved one. You want the best treatment, what is right for her. And that's something which is all very, very important as we go forward. So to me, when I talk about smart hospitals, these are the 4 pillars. We look at AI-powered intelligence because we have to make the hospital intelligent. You have to be able to connect to the sensor, the technology that we currently have. Can I basically get that information back into an integrated ecosystem? That to me is the key. Robotics and automation. And I'll talk about robotics very briefly because it's now entering the heart of hospital and healthcare, because robotic surgery ensures that whatever doctor basically was doing a surgery in the morning, let's say 7 in the morning, he's very fresh. Now you get at 9 in the night and you have to perform the same surgery. It's very natural to be fatigued. So that's where robotic technology can also be a benefit. You can actually make it a lot more easier for the entire team, for the doctor to operate as efficiently as he was doing before. And then cloud. How you can connect patients, connect equipments, connect the facilities better in a very seamless manner. All this is possible today. All the technology is there. It's just our willingness to use it. Now I'm just giving you a sense of what typically a real-time patient care pathway can look like. I'm not giving you the details, but imagine right from emergency to discharge. You have all metrics available. And why only emergency to discharge? You could even do it before emergency comes in. And I'll talk about one of the use cases I did at Max earlier, where we could even check point of care diagnostics before the person is brought into the emergency. You could measure and ensure that within the golden hour the person is reached in time. But let's look at the hospital for once. Within the hospital, can I ensure real-time dashboards, real-time analytics? with sensors available. You could have an RFID tag that can tell you where your assets are, where your biomedical equipment is. You could have an RFID tag tell you go to balloon time. Are you able to operate on the patient in time before the patient's life is lost?
Excuse me?
These are all possible with technology. It's just about our willingness to adopt. And these are hard numbers. Let me just talk about the key numbers here. So we look at, 8% is the actual, versus 15% national average using remote monitoring systems of readmission. Can you imagine you can reduce readmission by half by using technology properly? You can actually look at 94% bed utilization. It's a big cry over what you typically see today. You can enhance your bed utilization. You can obviously look at even enhanced ROI. We see in the numbers 38% lower cost to serve through post-operative telehealth solutions by reaching out remotely. And there is 7x ROI in 2 years if you do it well. That's the possibility. So clearly, you can reduce cost, you can enhance patient experience, you can enhance outcomes, all of this by amalgamation of technology with clinical and team effectively. That's the key power. It has to be a marriage. It has to be something which is done seamlessly together. I'll talk about very briefly cost savings and operational efficiency. We've talked about a few things here. So AI scheduling. We've done dynamic scheduling in hospitals. I've done that in Max, where nurses could be scheduled, we had people who were going on leaves. You could do a lot more efficient utilization of nurses by using technology. Saying this is where we need a 1:6 ratio in this particular floor. And here you probably might be okay because here you hardly have patients coming during the day over the last 6 months, over the last 1 year. We have the trends that can predict the amount of people that are needed there. So there is possibility around that to actually optimize schedules. There is possibility of also hiring right. I'm working with Medanta Hospital. We basically find that during the time when we have the dengue season, you need 3 nurses in OPD to look at vitals. Whereas regularly you just need not more than 1. Now if you were to understand when you need more nurses, you could really make it much more efficient, the entire process. And you could obviously use face-based recognition and many of the technologies that we currently have, which can make it even more easier to operate. But to me, you could also use AI for hiring nurses, the right attitude, the right quality. You could actually use AI for that. And then they complement this with skill building. You can enhance skills as per your need. So all of this is possible. It's just that we have to have a willingness. This willingness has been there in many sectors. Healthcare, unfortunately, is still lagging behind. We need to be open to embrace, because technology also working in silos will not deliver the results. We have to make it a lot more easier to use technology for doctors. That's the role of technologists. So to me, I'm just going to give you a quick sense. This cost reduction can happen by looking at each value drivers. And I'm not going to details because it does require some amount of stratification, understanding which patients to serve more, who are the bigger risks, etc. But you can get to that level of detailing and enhance the overall efficiency significantly. I mentioned 7x is what is possible in 2 years. Safety, another very critical aspect. I think we had Dr. Rahul talk about safety and experience. You do need both of these cornerstones to be accomplished. So patient safety is one of the top safety concerns that builds trust. And we all know that if you're able to use predictive analytics, you could know what treatments, what personalized line of treatment can you give to patients, which can be only possible when you have data being actually structured and available to you for a longer period. And it can give you very good insights. Today we have a lot of data, but not enough insights. That's where patient safety can be enhanced. You could look at reduced readmissions. You could even look at enhancing the kind of treatment protocols. What care pathways work best for what person? You could start using genomics, because genomics can tell you this particular patient type will react better to this line of treatment. And of course, there are other elements to this, but there is a lot that can be done if you start using data effectively. I talk about experience, and I think this goes hand in hand. Patients today expect a hotel experience in a hospital. You can't give it because you have short staff. So how do you ensure that you are able to give that experience? Only by using technology. 24/7, always available, even at home. You can't be available all the time, but you need technology to be there. And of course, it does enhance satisfaction significantly, because they need answers, and they need it now. And it can only be given when you have the scalability possible to technology. There is some specific implementation strategies because a lot of it is talk. We have to ensure it is actually implementable. It is using technology. So in NACS, for example, and care, the only board KPI I had was, can we ensure discharge happens before 12 p.m. for at least 75% of patients? Because I need my beds to be valid. That was the only KPI the board asked me. Which basically meant that if a patient has been told to leave the hospital at 9 by the doctor, he should not be waiting till 5 and 6 in the evening until the insurance approvals happen or until the pharmacy guy decides to come back and update the bills and reconcile the total billing. That was not the patient experience that a person wants at this point of time. So can we enhance patient experience with discharge optimization? Absolutely yes. You could make it available on mobile with the phone. You could have it connected to the cloud. Completely secure, by the way. Completely. And there are aspects like personalized chronic care. You can extend this beyond the boundary walls for patients. That's also very much possible. You can actually make sure that lifestyle problems, key things, like movement, nutrition, sleep, stress management are interwoven into what you do in the hospital. Because they're all complementary. Unfortunately, people are not realizing that you need a complete holistic type of treatment for a patient to become healthy. That's what we have to move towards, from sick care towards health care. Proactive health screenings, which can be done again very easily. You could even look at enhanced overall experience and safety. I've talked about some of these points, I will not stick too much, but let me just give you a sense of what's already being done. In multiple hospitals in the world, a lot of things are already happening. If you look at innovations, LLM model, Gen AI, a lot of this is currently in place. I mean, if I look at basically analysis of vast population data, now we have the large ethics and Cerners and the US and European countries basically using this data. But it's not currently being done in India. India is the data capital of the world. It's also the disease capital of the world. If we start harvesting our data, we had one of our speakers just talk about the importance of data quality. So critical. We do not need to only focus on accreditation, we need to focus on actual outcomes. That's the most important element here. So that's what we're talking about, enhancing the data and making it a co-pilot, enhancing diagnosis. Can we make it much more easier to diagnose? Can we augment the doctor on this? With cloud, you can actually track patients. You can track clinicians, you can track patients, you can track equipment, complete visibility, real time, available, for you to make the maximum use of this. And I'm giving you some examples. These are all some global success stories and also the few that we did in India with Max and Care. I mean, if you look at Novant Health and Tata General, they've done some amazing work in integrated healthcare systems, monitoring systems with smart home implementations. You have ambient AI, which can even monitor the temperature. I'll give you a sense. In Max, we had one problem which actually happened a long time ago where we actually had in Shalimar Bagh one particular baby who was 5 months old. He was pronounced dead because there was no movement. It was not the fault of the doctors, not the fault of the team, but there was no movement. If we had ambient temperature, we had monitored the humidity, the entire parameters there, you could have known that this baby is still alive. And there would have been a huge I would say, improvement in terms of the overall reputation because this was flat and there's no fault of the doctors, no fault of the hospital. But this is where technology can play a role. It can guide and augment. In some ways, the hospital staff and the doctors to say, this is what we need to do right now. It's just additional information because there's so much starved for time. There's no time available. Now, this is what could be done here. We could look at AI-added diagnostic platforms, which could make it so much powerful because you have information that can help the doctor predict this is the kind of line of treatment I want to do. The information is already entered by the patient in a small self-service information in a symptom that entered there. The AI goes to play and then tells you this is what you need to copy, possibly look at, and the doctor can then select from 3 options. This is the right option for treatment. Very much doable because he doesn't have time. If you look at the difference between a first patient who basically gets very, very happy with his doctor and what he obviously feels very upset about is the time the doctor is able to spend with him. That's where India, we are very much at a loss because we do not have time. There's so many patients to be looked at. So to me, that's again very important. And we talked about this fact that can we start using wearable devices? Can we go beyond the boundary walls? That's again very much possible. In Max and in care hospitals, We now, in fact, we piloted bike ambulance. We piloted how we do point-of-care diagnostics, from the field. That made it very powerful. You had health clinics that are today possible at remote areas, which could be hub-and-spoke model. Again, I'm saying these are possibilities. I'm not going into details here, but I'm just telling you, these clinics, Mayo Clinic, John Hopkins, Cleveland, Mount Sinai, Shiva Medical Center, they're all examples in front of us. India is the place for innovation. We make technologies that actually are the most cost-effective in the world. We imagine Mangalyaan, right? It happened that lowered the cost of the budget than a gravity movie. That is the kind of innovation we can bring in. And all of these people are basically doing this because they have, let's say, the will to do it. And of course, they're spending money on it. There's some technology, which costs their money. But there is a significant amount of value that you can create. 7x, as I said, on the technology cost. So that's the kind of benefit that could come, when we do this properly. And the metrics, outcome measures, we start measuring it. We start looking at average hospital stays. Can we reduce ALOS? Can we look at customer ratings and feedback? Can we look at health gains, the kind of waiting time reduction in OPD and IPD, or readmissions, equipment utilization rates, patient retention rate? If the patient is going to come back over and over again, imagine the lifetime value of the patient. I said 81% people basically don't come back to the hospital. Imagine the patient is always loyal to you. They become your ambassadors. I'll not spend time here, but I'm just saying, in general, this is proven. It's working in multiple places, multiple countries, and India could, in a way, lead the world, given the data we have here. Sarvodaya, so much importance to quality, incredible. I really feel that if we can basically start taking the lead to enhance quality, to focus on the key metrics, there will be so much possibilities that can come from this. So we look at, the reduction in mortality, we look at reduction in morbidity, reduction in readmission rates, and the kind of effort that is coming in terms of, actual, nurses, etc. We can really reduce the time we are spending, reduce the time for nurses, reduce time for doctors, and make it much more useful for the patients. Cleveland, I'm not giving too much examples because I know we've got huge numbers. Max Evercare, also we did a huge amount of very, very good innovations that was there. Step-down ICU care, which could reduce the time in ICU. Because if you move into step-down ICU care, when you don't need the patient to be monitored in ICU, let's say a knee surgery, after the knee surgery is done, you don't need the person to be in ICU. You need step-down ICU care. You just need to be look at certain parameters, and you can save the ICU beds for somebody else who needs it more. We did this, again, digital twin smart asset management. How do you maximize your asset management? How do you enable the assets in the right places at the right time? If you have multiple hospitals, can I basically provide that portable asset to some other institution? But these are all things we've done with higher equipment uptime, 15%, 30% lower cost to serve, and over, we save 850 lives in 8 months. But I'm saying there are multiple outcome metrics that can basically be tracked if we do this properly. So, clearly, we do need to look at some challenges. I'm not saying they're not challenges. We do need to look at integration complexity to existing legacy systems that we have in hospitals. The IT team needs to be on board. We need to make sure they are part of the journey, very, very crucial. We have to look at data privacy. We've got DPDP Act that's coming, so we need to make sure that we're compliant with the DPDP Act. And we need to look at the digital readiness of the hospital, of the doctors, the maturity, to make sure that culture becomes, much more amenable to do this. And doing it in conjunction, making it easier for the users, making it easier for the doctors, easier for the operations staff, for the nurses to embrace technology. That's how the technology should be built. Technology by design to serve the doctors, serve the patients, serve the nurses. That's how it should be built. So last slide, I will just say we can obviously do current state assessment, look at where are the gaps, and then look at a blueprint. What could be done for smart hospitals? How could we really enable the vision, realize the vision that's there for the management? Of course, a very scalable and secure tech stack, and an operating model that is durable and scalable and can continue to add value. So that's basically what we do. Of course, enables continuous patient engagement, health monitoring, seamless clinic integration, and of course, we also offer personalized wellness plans. That's what we do with Prana-AI. So, key thing is to invest strategically, embrace digital transformation, and build a new happy future together. Thank you.
Thank you so much, sir, for the enlightening session. Please be on the stage, sir. So, for the felicitation, I would like to call upon Mr. Lakshman our Chief Information Officer, Sarvodaya Healthcare, Faridabad, to please felicitate Mr. Sumit Puri, founder and CEO, Zenvive Wellness, Prana-AI. It was a very insightful talk, and we actually really got to know about creating a smart hospital with innovative ideas, like addition of AI, genomics. Thank you so much, sir. Next, our most awaited debate session. So we are having our eminent team of speakers, and for that I would like to call upon our moderator of